Why this sciatica occurs? What are the reasons for sciatica? As I just told you, 85% of the people are not suffering from the sciatica pain. It must be because of what aggravation, some type of injury, some type of heavy weight lifting. Just for a period of time, they feel the pain, and that is general back pain. But of course, 15% of the population are really suffering from the sciatica pain. So, what are the reasons? Let's see. The most common problem is slip disc. So you can say out of 100, 2 persons are specifically suffering from the sciatica because of the slip disc. That means those who have already history of back pain, specifically the herniated discs, that is slip disc, if they are already suffering from this problem, then they are very much prone to face the sciatica pain or sciatica problem once in their lifetime. So you can say 2% are the possibility throughout. The reason already because of the weakness of the backbone, lumbar vertebral problem, obese problem, the nerve get pressurized and pain is aggravated. Sometimes the gel-like center of a disc pushes through its outer lining and pressure on roots of the nerve. So again, when the roots of the nerve, we all know like our spinal cord is a structure for our body. That is the stand for our body. So whenever the spinal cords are get damaged, or we know like there are so many thin nerves are coming out from this vertebral column and spinal. So due to any imbalances, due to any unnecessary pressures on this type of tiny thin nerves occurs, so it again pressurize a specific nerve, that is sciatica nerve, and because of that imbalance and pressure, they put more pressure on the sciatica nerve, which results in sciatica pain. So specifically those who are suffering from the back pain or the slip disc problem, they are again very much prone to face the sciatica problem. The another reason is the spinal stenosis. We'll definitely talk what is spinal stenosis, but this is one of the reason because of the spinal stenosis, sciatica may occur. So these are certain common problems or root cause which are responsible for sciatica. Okay. Now another causes, the specific scientific cause. Like as per the research, there are specific 4 causes are determined which are completely responsible for sciatica. What are they? First of all, the spinal tumor. Of course, it is very rare. See, as per the tumors occurs in other part of the body, the spinal tumor is a very rare case. But we have the patients throughout. Those who are already suffer from the spinal tumor, they are also very much prone to face the sciatica. What is spinal tumor? So, sciatica may result of the tumor growing inside or along the spinal cord or the sciatica nerve. So when the tumor occurs on the nerves, on the ends of the nerves or on the sciatica nerve, as the tumor grows, it puts pressure on the nerve, and because of that, the space over the nerve becomes very narrow. They don't have any specific space or the gap to circulate the blood. Because of that tumor, the pressure comes on the nerve and it aggravates the pain. The second cause is sacroiliitis. The second cause is sacroiliitis. Sacroiliitis means what? It's an inflammation of one or both of the sacroiliite joint. See, there is a sacroiliite joint. So if there is any inflammation or pressure on that, it starts paining. It can cause pain in buttocks, lower leg, lower back, and it radiates to the end of the legs. It can be caused by arthritis, injury, infection, and sometimes during the pregnancy. See, whenever if it is in general, like we have, for an example, a space for a single object, and if you put two or three objects in that specific space, so what happened? First of all, it get flooded out of it. Then if there is certain stretching, rubbery things, so it's try to stretch that place and try to, you know, have that two or three other objects inside. So what happened when it tries to stretch? It gets pressures on the surrounding area because of the stretching, that space created, and it gets pressure on the surrounding things. Exactly like that, if we have branches of the nerves which is very thin and tiny passing through the spines, now if we put little pressure on that and it tries to spread out, so what happened? It first of all is stretch, and once it spreads, so it gets pressure on the nearing nerves, the surrounding nerves, which again creates the pain because of the less space. The inflammation comes out, right? So this is what exactly the sacroiliite is. The sacroiliite joint are affected, and due to the end of the branches of the spinal nerves, it gets inflamed, pressured, stretched, and start paining. Specifically, it happened when the degenerative problems are created, like arthritis, specifically during the pregnancy for a female, like they have put pressures because of the carrying child. They have stretched their obviously it's natural stretching of the stomach because the fetus inside there, so that pressure comes on the backside, and because of that backside pressure the sciatic nerve get pressurized, and because of that the pain aggravates. So sometimes because of carrying mothers, they have more chances to develop a sciatica till the pregnancy. Piriformis syndrome, that is another cause. There is a piriformal muscles on the back. So what happened? The muscle goes into the spasm. It puts pressure on the sciatic nerve. So tingling symptoms of sciatica occurs. The last cause is injury or infection. Due to any type of injury of your back or any type of infection, this may cause the sciatica pain. It may be a muscle inflammation, or muscle pain, or the muscle infection also. So these are the cause mainly responsible for sciatica. So this is all about the sciatica.